So today is October 23rd. It's a Sunday, and we are discussing Ayurvedic examination. So just remember these three words: darshanam, sparshanam, prashanam. It rhymes with each other, and that's the heart of Ayurvedic examination. Darshanam, sparshanam, prashanam. So darshanam is, so when we were doing the block one, we talked about how Vata, Pitta, and Kapha Prakruti have different physical characteristics. A Vata person may have a thin body, they may be tall, they may look light, they may have dry hair, dry skin. A Pitta person may have more reddish skin, they may be normal, they may be very muscular, they may have sensitive eyes, they may have red hair. Kapha may be a little overweight. The way a person talks just by darshanam to see. So darshanam is when you are going to do your final case studies. So Stacey, this class is actually for advanced students that you can attend. So darshanam, when you're going to start doing your case studies, for example, I've asked you to make a case study for Rich yesterday. And we can't really see Rich because he's not here. All we can ask him to do is we can have him send a picture and a picture of the tongue. Unfortunately, we cannot do nadi. So looking at a person and also the way a person describes themselves. So yesterday, when we discussed your case study, Zach, you said that the person who's in Brazil, when he describes, even if he ingests something which is cross-contaminated with wheat, it's very sharp pain. So it is very important for us to listen to how a person is describing, to look at them, their expressions as well. If somebody is describing pain and their face contorts, so you have to be like Sherlock Holmes, really. It's a lot of deduction as well. I've had one person who was very vata, and she would always describe her pain as a knife going through her. So obviously there is inflammation in the pitta vein there. So you have to listen to, because nobody knows their body as a person. You have to listen to the cues. So Ayurveda gives so much importance to the darshanam. And of course you have sparshanam. And unless you have a massage license or you have some other kind of license, you would really not ask you to touch your client. Or you are a registered dietitian or you have TCM, because it would not really be legal to examine a person. And even if you do, one of the things, words that I use is biofeedback. And really, Nadi Pariksha is biofeedback. When you touch the Nadi and it gives you vibration, it is feedback. So sparshanam is actually touching the person and checking their body temperature, if their extremities are cold, checking for their pulse diagnostics. And we will talk about, pulse in December, or when we get to that Ashtavidi Parikshan, and Dr. Sahana Kidlaya is the teacher for that. I will be helping. But the way I have learned pulse, I have learned from a different guru. It's very, very spiritual. We've had to do lots of mantras and meditation and Vedic mantras that go. So we actually pray to, we have specific mantras for Vata, Pitta, and Kapha pulse. We have specific mantras for each organ, and we pray and we ask it to manifest on our fingers. So that's a different style. And Nadi Pariksha, different people do it in different ways. So I've got my way, but we'll have Sahana teaching conventional way, and then I can talk about my unconventional, energetic Nadi Pariksha as well when you're here in December. So till now, in block one and all the evaluation forms you had, you focused a lot on prashanam, asking the person what is happening. Prashanam is questions, sparshanam is to touch, darshan is to see. Darshanam, sparshanam, prashanam. So when you do your case studies, I'm going to ask you, what was the result of the analysis after darshanam? What was sparshanam? What was prashanam? So here, when we look at the tongue, we look at the eyes, you look at the face, you look at the lines, we are looking at this would come in the darshanam. If you know how to check the lymph nodes, if the lymph nodes are swollen, massage therapists can do that. I think they can check also for pain. Um, any clinical person can do that. Chiropractors can do that. But unfortunately, you can't. You have to let the person know you're not diagnosing, because Ayurveda is not recognized as a medical system, but only as a complementary health system. So before we do that, I have to let you know that this is, you can have to tell the client this is for information purposes only. It's holistic, and they must have permission they must consult their physician and doctor. And you're not really doing the diagnostics, it's just a biofeedback, which it is. So till now we had you filling forms, fill form, Prakruti form, Vikruti form, and then count the number of forms. Now please remember that is completely 100%. It'll never be 100%. It'll always be defective, because everybody will put their own spin on things. Give you the physical characteristics are fine. Even in the Prakruti Vikruti form, you have the physical characteristics, you have the emotional and mental characteristics. And when a person fills out their own form, they are giving you their own perspective of, I am not intelligent, or I've had somebody who had an IQ of 175 who was very insecure with themselves write that my memory is bad, and this person has photographic memory. So you have to be aware of whether, when they're filling out the questions, is that coming from their own perspective of how they see themselves. So always a Prakruti Vikruti written is, I would never consider it 100%, but I would say it gives you a 60% idea of what's happening. Having said that, I actually, before a person comes to meet me, I have them fill out a form even before they enter. So we have a basic idea of their physical and emotional and mental characteristics. And the first thing that I do is I will check their nadi, and then I will look at their tongue, and then I will have them just talk to me. Just tell me what's going on with your life. I am not asking Prakruti with you. Just tell me what's going on. And then I try to find out and match all the dots. So from there, immediately we know the Vikruti. So as soon as a person comes in and you ask them to, so what is it in the tongue that you're looking at? You're looking at the body of the tongue, shape of the tongue, color of the tongue, and spirit of the tongue. So Midori also does the TCM tongue. I'll probably have her come and talk about the TCM, because it's a little bit different than Ayurveda when they examine the tongue from TCM perspective. And then we determine the condition of metabolic digestive fire. We find out the Agni. So what is the quality of Kapha or Pitta or Vata? What is the quality of Vata? Give me 2 gunas or 3 gunas, the opposing qualities of Vata. Give me any couple of, it's cold and dry. So the tongue body of Vata will also, a person whose Prakruti is Vata may have a tongue body that looks like Vata. It can be light, it's not going to be very heavy. And Vata tongue sometimes have very little tremors. It can never stay still, because what is the nature of Vata? It moves. If it's a Vata Vikruti, if it's a Kapha person or a Pitta person with Vata Vikruti, we know that which is Vata Vikruti, then it's possible that there will be a coating or there will be cracks on the tongue. But it immediately lets you know this person's Vikruti is Vata or this person's Prakruti is Vata. So immediately that is the case. What is the quality of Kapha? Give me a couple of qualities. Any quality of Kapha. What is Kapha's quality? It's lethargic, it's heavy. Yes. So a Kapha's tongue is usually heavy and stable. It's not going to have any tremors. The shape of a Kapha tongue is different. Of course, when you're here and you're actually doing Jihva Pariksha, we will teach you, and you can look at each other's tongues. The color of the tongue is also a little different. A Kapha tongue is generally may have a little whitish coating on it, which is normal for it. Vata tongue is slightly chalkish brown, and Pitta tongue is very red. If it's extremely red, then there's a Pitta imbalance. So the Pitta, Kapha, Vata tongue are different. And tongue is so amazing. Whatever physiological changes are taking place in your body, it represents in your tongue. Now, doing Nadi Pariksha, when you're checking the pulse, we have different levels in the pulse in all the three fingers. So there's a superficial level. Now, superficial level only tells us what are the physiological changes happening now. If you've just had food, for example, if you've just had lunch, then it's possible that you will feel activity in the middle finger, which is Pitta, because there's digestive fire. So it's only telling you what's happening physiologically, and it's not necessarily bad, but it's telling you what are the changes that are happening within the body. But when you check it against the tongue, you can be sure. Now, this is not a very good way. Ideally, you should be able to check the pulse and know exactly what is wrong. You should be able to check the superficial pulse, the subdoshas, and the deep pulse. So Prakruti, Vikruti, subdoshas, Agni, everything can be determined by the pulse. And that's a good Ayurvedic Vaidya. But it takes years and years and years to practice that. So for students, we have only 500 hours. So what to do? In 500 hours, you have 35 hours of diagnostics. In 35 hours, what can you do? So what I do is, if you can, between the darshanam, looking at a person, between asking the questions, between checking the tongue, and between checking the pulse, you will be able to make as accurate an exam as possible and determine the Prakruti, Vikruti, Agni, Dosha, Dhatu, Dushya, what slotas are affected, everything you do. And that is the most important thing at the end of the day. It is important, the general strength of individual. If somebody comes to you and they do not have enough ojas, we know Rich is recovering from pneumonia and he didn't even have the strength to eat. So immediately, the first thing you need to do is strengthen this person. So you have to increase the kapha. You have to give ojas building foods, even if that person is kapha. So you have to, this is the PTO, Pran Tejas Ojas. Observe the emotional and mental nature and state of Pran Tejas Ojas. If a person is lacking Pran, now I just saw one lady last week, and she's a kapha person, and her tongue had lots of tremors, lots of cracks, lots of derangement, and it kept on, she couldn't keep it still. It kept on moving towards the left. So according to certain Ayurvedic books, when the tongue is not still and it is moving towards the left, that means a person's Sushumna Nadi, Vata, is not in alignment, which means that they have some nervous disorder. So I asked her if she had some nervous disorder, and apparently she has schizophrenic. So very, very heavy duty Vata. And you would be surprised, you can even see that in a baby's tongue as well. Immediately, anything, you've had a cake, you've had heavy duty cream and cake for dinner last night, it'll show in your tongue the next morning. So we're not looking for those immediate physiological changes. We're looking for deeper changes, crack in the middle of the tongue, or what portion of the tongue it is. And it is very important. We have talked so much about Satogun, Tamogun, and Rajogun. And the way I learned from my guru, we also are trying to determine the Tamogun, Rajogun, and Satogun from a person's house. And I also attended Maharishi Ayurveda's clinical pulse technique, which is very, very different. And there's something really amazing the way they do it as well. And we'll talk about that in a little while. And a lot of focus is given to three gunas there as well. So when you're looking at the tongue, what are you looking at? Are you looking at, oh, it's chalky brown? So obviously a person should brush their teeth. They should scrape off the ama of the tongue. And then they should come to you. And one of the first questions, once you observe what is in the tongue, you don't just tell a person, okay, this is what's wrong with you. Then you start asking, and you move on to prashana, asking questions. Have you had this problem or that problem? Remember, you have like an hour consultation. if you were to do all the forms and all the questions, then it will take 2.5 hours per person. Nobody has that kind of time. So you have to have a more efficient way of doing everything. And I've seen this with people who come and intern with me. So I tell them to educate the client or the patient, and they will take hours educating. So you have to have an efficient way. So one way is have them fill out a Prakruti, Vikruti form even before they come to you. And then you already know, you have a starting point. You have the symptoms, and then you check the symptoms, and then you can ask relevant questions. And then you should have ready-made handouts for everybody as well. Determine the fundamental dosha imbalance. So when someone's coming to you, obviously whatever change is taking place within the body, that's what we're going to treat, but we keep in mind the Prakriti as well. And this is very important, whether it's Sama or Nirama, because the protocols in nutrition, again, for Sama and Niram change. If the person is in Satogun, Tamogun, Rajagun, it's changing again. Determine which 6 stages of disease is involved. If it's a chronic stage, I would say please do not get into it. But if it's in the first, if it's the Samprapti, we'll talk about Samprapti in a little while. If it's in the first few stages where it is treatable, then we'll get involved. You don't really want to get involved in, but we can still help a person with. Somebody's come to you, they're on 25 types of drugs, they are under 2 different physicians. Better not to get involved unless you're unless you have a lot of experience. And even though I do have a lot of experience and I work a lot with chronic patients, I'm actually working with MDs who also practice Ayurveda, so I can call them and talk to them. They can tell me in Ayurvedic terms what is happening as well. So, and if I feel that I cannot do, like I had a patient who was due for a liver transplant, and I really can't do anything. Sorry. We want to work with people, and a lot of people will come to you, when it's kind of too late. But if you can reverse it even by PK, by Panchakarma, then it's a good time. To give you one example, Zach's friend in Brazil. So that's years and years of issues. But we can still help manage. It hasn't manifested chronically yet, but it's almost there when that, if he's having such acute allergies, it might manifest in some chronic disease later. But if we the intervention, the Ayurvedic intervention now can help manage it. And that's what Ayurveda is all about. It's prevention. Let's stop it right here and prevent it. Determine environmental and lifestyle factors. Determine motivation and impulse. So this motivation thing is, again, I've seen in students, because we have yoga therapy, we have nutrition, we have herbs, we have pranayama, we have jyotish, we have so many protocols, daily regimen that we can give, that sometimes we go overboard and we want to give everything. But what will happen if you give everything to your client? They're probably going to run away because it's too much. The whole idea of determining Vikruti is first determine what is the motivation of this person, how determined are they to follow and make a change in their lifestyle. Sometimes I've given nothing but hot water and just, do not eat red meat and just take hot water. And I've had people who've completely committed and they've made changes in their life, and within 3 days they've seen a difference. So they're both types. What is their motivation? We cannot do everything. So I just wanted to put that out in the open. So we start small. Okay, now let's talk about Vata tongue. Like I said, a Vata tongue will have qualities of a Vata. It's thin or long or small. It's light. It looks light. It's not heavy. And sometimes it trembles. It can be pale or dull. Remember, sometimes Vata is anemic. And so all the qualities of a Vata, the light, the dry, the thin. And why is it trembling? Because of, Vata is movable. And if it's darting one way to another, there could be a Vata derangement. And how do we know if there's a Vata derangement? When there's lots of cracks on the tongue. Does anybody examine their tongue in the morning? Yeah. So what I would like is if you could, when you do your case studies, if you could actually take pictures of tongue. That gives us a great idea. I really like that, and I also want a picture of her because the person still remains anonymous with the tongue. Now, Pitta tongue has all the qualities of Pitta. It's medium size. It can be shapely or pointed. Actually, it's a little bit reddish. It's more pink. And this red, blue, purple, yellow, green comes. This changes when a Pitta is very high. For example, if the Agni from the Chaturagni has moved and it is moved to the lungs, then the sputum will be yellow. And also the ama of Pitta is, then Kama Pitta is also yellowish. And Sama Kapha is greenish and whitish. So the sputum and the mucus of Kapha is greenish, and it will also have that white, thick, greenish coating on the tongue. So Pitta, when it's nirama, when there's no ama, then it's very red, and then it has some vata derangement. It can have some cracks in the tongue, and then there's actually a problem with Agni has moved from the GI tract and is moved to the skin or it's moved to the lungs. Then there's a yellowish appearance of the tongue. Remember, the color of Pitta is yellow. So if anything is yellowish, and color of Pitta is also red. If that is what's saying, it will also manifest that yellow-green will also, yellow and red also manifest in the skin as well in Rajat Pitta. Exactly. A Kapha tongue is exactly like a Kapha looks like. It's big, it's very strong, it's not going to dart here and there, it does not have tremors. Now, I'll give you one example. I had a girl, she was a medical student. Her parents got her, and for an Ayurvedic consultation. And when I looked at her tongue, she was a Kapha Pitta, large tongue, no problem. And apparently she ate well. And she had a vata derangement, and her tongue was trembling like nobody's business. And I said, "What is your stress?" She says, "Funnily enough, I have absolutely no stress. I have no problem." She hadn't had periods for 3 months. She didn't have an appetite, and she's telling me she has no stress. So obviously, her mother was sitting next. So she's not telling me, but if she's a Kapha person and she's a little bit of crack, and her tongue is trembling, so the trembling tongue, there's no what we call stir. Stir means there's no stability. It's vata is going up and down and left and right, and it's definitely in her brain. There's hyperactivity there. There's hyperactivity in her Sushumna Nadi. So this will happen when people tell you something else, and there's something else. I've had people come and tell me, especially husbands, when wives drag their husband for a consultation, the wives will say, "Oh, he's always so stressed, this, that, and he's got tremors and vata derangement or reddish tongue," and they say, "You're absolutely fine," because I think it's a manly thing to not accept that you have a weakness. So I don't know, but I get that all the time. Does that make any sense? In real world, people will deny. So you're seeing the symptoms right there. They say, "We have never stressed, we are very happy, there's no problem." First of all, nobody's happy. If you were happy and if you didn't have a problem, your wife wouldn't have dragged you here. I actually had a student, she dragged her husband here, and he did the Prakruti, Vikruti, and he said, "This is like, doing a test on the internet about if I get along with you or not. This is terrible." And he went on and on speaking against Ayurveda. How Ayurveda was so funny and it didn't make any sense and this and that. So obviously I had to impress him and make him convince him that Ayurveda is not bad. So I took his pulse, I looked at his tongue, and I just asked him how long. First of all, he said, and he had no symptoms, he had no health problem, he just had a little bit of stress. And I said, "How long have you had a back pain in your lumbar spine. Oh, and then he was dumbfounded. He says, how do you know that? Because his tongue was showing heavy duty pain. Apparently he had a bad accident 10 years ago, and he had been going therapy for years, and his lumbar spine would act up. So eventually he was convinced, and then they come regularly now. But sometimes you have to do that to convince, because Ayurveda people don't know Ayurveda. They've come to you because they've heard about it from A, B, or C, or they've looked up in the internet. So they're not convinced about following Ayurveda as they are about TCM or going to a chiropractor. So it's a whole new world. But I don't know if you will deal with such people, but I've had to deal with it. Does anybody have a textbook of Ayurveda or two? Tongue is an organ map. It's a mirror. So your organs are, when you have a mirror in front of you, everything is inverted and opposite. Left to right is right to left. So the tongue is a mirror. The tongue is a mirror for us. We do not, in Ayurveda, we're not doing tests. You're looking at the nadi, you're looking at the pulse, and we're looking at and we're examining the tongue. Tongue is like we are holding a mirror to inside of a person's body. So let's divide the tongue into left and right. Herein, this is left, and this is right. Okay? This is left and right. And in our body, the top half of a body is what? The top half of a body, ear, nose, throat, head, lungs is kapha. So in tongue, it's exactly the opposite. This is kapha. So the top of the tongue, herein we have the thyroid, herein we have the lungs, the left lung and the right lung. And then of course we have, this is the heart. So it's the opposite. So our head, our udana vata, our ear, nose, throat, lungs are on the top of our head, and this is where they're located on the tongue. Now let's move on to pitta. Pitta is small intestine and lower one-third of our stomach. And in our tongue, pitta is exactly there in the middle. You have your pitta here. So what are the organs that we'll have in the pitta? We'll have the spleen, and we'll have the liver, we'll have pancreas, we'll have 1/3 of the stomach, the lower one. So part of the stomach is in the kapha zone and part of the stomach is in the pitta zone. So when you see any kind of discoloration or any kind of marks in this part of the tongue, then something to do with kapha. If you see any kind of discoloration or coating or derangement or any kind of mark, then that is in this portion, that's a pitta issue. Let's move on to vata. Now vata is in the colon, right? But in the tongue, this is where the vata is. This is your vata zone. I'm not very pretty at making these drawings. I hope it's making sense. So here we have the intestines, we have the colon, we have the left kidney and the right kidney. This is where the vata is, right? So if we see any kind of coating here, if we see any kind of coating here, so obviously it is something to do with intestines because that's the portion of intestines. Let's say somebody comes to you and they have very, very low energy, they cannot breathe. Then you look at their lungs and you see this funny, you can see striation marks, or you can see some kind of cracks in the left and right side. That means their lungs are affected and they also have malabsorption. So Rich, since you've had pneumonia, I would guess, and you're a Kapha person, that right in the top left and right side of your tongue, either you will have some cracks or some signs of malabsorption like teeth marks. This is my guess, considering you've already told us your symptoms. So it's a good idea if you look and let us know. And sometimes if you see the tip of the tongue, so all of these represent a taste. All of these. Let's look at the taste. So then a person, each heart and lungs is sweet. Actually, this is different. Salt is kidney, bitter is liver, astringent is, this is actually according to TCM, not according to Ayurveda. According to Ayurveda, bitter is liver and spleen. Pitta issues. When somebody has pitta issues, you give them bitter. It's also small intestine. If somebody is craving salt, they're just craving salt, you want to look at the kidney section right on the top of the tongue. Then somebody is craving pungent things, maybe kapha is wrong, you want to look there. Sour is lungs, according to Ayurveda. And sour is also thyroid. Sweet is heart and lungs. So if you were to divide the tongue into left and right, each area of the tongue, and if you look at page 109, that's a good page to look at. Here it describes the Jihva. Now tongue is called Jihva. Jihva evaluation is Jihva Pariksha. So herein there's a really nice chart you probably want to make and stick it in your office somewhere. There's size of the tongue, small, moderate, large, shape of the tongue, color of the tongue, tip of the tongue. Tip of the tongue is important. Also, if there is any problem with the tip of the tongue, it's about thyroid. It can be hypothyroid or hyperthyroid as well. Activity. A Vata tongue is mobile. Pitta tongue has small movements and Kapha is pretty stable. Moisture. What is the quality of Vata? It's dry, so Vata tongue can be dry. Pitta tongue can be moist. Kapha is very glossy and wet. And then there's the surface. And if a person has coating, there's coating. And here I look at the ulcers. Multiple on tips, central due to hyperacidity, margins. You have the odor, the taste buds, the tongue nutrition. So if you look page 107 to page 111, you should actually read this. This would be good. You have cracks and ripples along both sides. This is what I'm talking about. So because you've had pneumonia, so usually patients of pneumonia will have ripples. Ripples represent the Vata derangement, and the cracks also Vata derangement, and they can also represent malabsorption, or the nutrients in your body are not getting assimilated. So obviously at this point I would put you on a soup diet, very rich broth, because body is not, it's still recovering, in a recovery stage. So I'll ask you to eat a lot of maybe khichdi soup. So yeah, so one of the things, of course, I'm going to give you is tulsi and then dashamula, and give you herbs that actually strengthen your lungs. Maybe have you do some pranayama in the morning, get more oxygen in, do chest expansions. So if you look at page 111, so it's very hard unless you've actually seen a person's tongue, but let's focus on a few of these. You see the cracks right in the middle, that's chronic Vata derangement. And then it's the tremor. If the tongue has tremors, it also means stress. It can also mean some problem in the nervous system. This person may have some behavioral disorders as well, not necessarily. The last one is emotional long spinal column. Also when somebody has this deep line in the spinal column, this also represents your spine. So the chances of a person having back pain, so if it's at the top of the spine, that is your cervical vertebrae. If it's at the middle, it's your thoracic. If it's right at the end. So you might, sometimes it could be anything. If a tongue is not normal, if it has indentations, if it has cracks, if it has ripples, then you look at which point there is. And then you cross-examine it with, oh, this is the point of the heart, of the spine, or the kidney, and there is some problem happening here. Of course, this takes a long time. Today is just an introduction. So let's look it up and look at delicate lung depressions. So Rich, do you have something like that? So you've always had that. That's because, oh, okay. The deep crack along the entire length of your tongue would be the emotional long spinal column and some back issues. So it's good you do yoga. The only way to get rid of this is actually do meditation and do yoga as well. Deep cracks on both sides is chronic malabsorption. Could be. But are these cracks or are these tongue marks? See, I don't know till we have a picture. Okay, now let's relate this to this Shadarasa. Now, if you go and look at the tongue, this is a TCM tongue. In Ayurveda, at this point, since we're only introducing you, you just look, this portion is lungs, this is heart, this is stomach, so this is Vata, Pitta, Kapha. So for now, just looking at the three divisions of the tongue, the Vata portion, Pitta, and Kapha. You're not going in detail. That's all we want you to do at this point. And every morning, examine your tongue. Let's look at this. That is one Ayurvedic tongue. There are different points on the tongue, and each point represents. So here in this, you said there's a deep crack here. When anybody has unresolved emotional trauma or issues, or even unresolved stress that they're not taking care of, it will show in the spine right here. And also, if there's some back injury, spinal injury, it may also show up here. Remember, this is something that we may not even be aware of. I've had people that said, we don't have any problem, and then 2 months later they call us, oh, my back hurts. So let's see if someone has, these are the lungs. If somebody has these kind of marks, and this can come if somebody's had antibiotics or have been sick. There's a problem with assimilation of nutrients. And also, all of these portions of the tongue are associated. Yes, it's possible it's one or the other. But at least you're open about it. When I get men and I'm telling them you have deep emotional trauma, they're like, we have no trauma. It's very hard to talk to male patients, especially when their wives or partners are sitting next to them. They don't want to talk about it. And you can see that there's, so you have to be very careful. Also, if you have, dosha change is taking place right now, and it will eventually manifest in A, B, or C. Because only in Ayurveda we have something called the pre-symptom. I've had people, and I've told them that you want to get checked for A, B, or C, and then they've gone to the doctor and nothing's wrong with them. But the same thing is manifested a year later. Because only in Ayurveda, the pre-manifestation, so dosha has traveled into the dhatu, it has traveled into the organ and it's affecting it. But it's not showing up in the test or the blood work yet, but it will show eventually. And that's when you can catch it and nip it in the bud and start helping the person. This is why Ayurveda is so amazing. One problem that, when we were in India, and Dr. Sahana will also tell you, she's always telling us, that people don't go to doctors in India till, it's a completely chronic stage. And then you cannot really help anybody, and they have to go to a physician. It has to be a stage where it's more preventative. So there's some problem. So, at that point when someone comes to you, say, I went to the doctor, there's nothing wrong with me, but I feel out of balance. I feel that there's something wrong. I don't know. I can't put a finger to it. I just feel out of balance. That means they can feel their doshas moving to the dhatus. They can feel the imbalance, but it's not showing up yet. But in Ayurveda, we are going to take that very seriously. A person saying, I'm feeling out of balance, it means they're out of balance. Unless it's a very vata person saying it, then it's possible they're hypochondriac as well. And I've had hypochondriac. They want to take every herb. They come to my office with 25 herbs and Chinese medicine and this medicine and homeopathy, and I have to say, stop, stick to one form. All right, let's move further. Let's talk about the colors here. When the color is pale, it means low prana. In TCM, it means deficiency of chi. Again, that means low prana. And biomedical, it also means anemia or lower plasma proteins. It may also mean, another thing that it may mean is that there's an infection and there's not enough production of white blood cells, because it's the white blood cells that show. So not enough production of white blood cell may also be indicative of a pale tongue. When the tongue is slightly purplish in color, please remember, if somebody has had a purple ice cream or a cake with purple color in it, don't examine it. Best way to examine a tongue is when they brush their teeth in the morning and they haven't eaten anything, they haven't had coffee, they haven't had chai, and they have scraped their tongue. If not, keep a scraper in your office. I have a toothbrush and a scraper in my office. Sometimes I ask them, if you had something to eat, then please go and brush your teeth and scrape your tongue. I've got loads of them, disposable ones, and then I check their tongue. That's the best way. The even better way to examine a tongue is ask them to eat a very clear soup for dinner. Because if they're going to have any kapha foods at night, or pitta foods at night, that will be showing in the tongue the next morning. So ask them to have just soup at night, and then the next morning when you check it. The best way to do any examination is morning time, empty stomach. So you as Ayurvedic practitioners, always open your office at 7:30, 8 in the morning. That's the best time. Worst time to do any examination is sunset. In fact, no examination should be done after sunset. Nothing should be done on the sunset. Or also doing any kind of examination on Tuesday and Saturdays is not suggested, because Tuesday and Saturdays are days of Mars and Saturn. So they will manifest karma on the tongue. So you always want to try and not do it on Tuesday or Saturday, the examination. Other stuff can be done on Tuesday and Saturday. So I actually I try not to work and see first-time patients on Tuesdays and Saturdays, and I see them on a Sunday, because that's the day of Ravi or the day of the sun. So we use a lot of things. So purplish, it's not purple really, it's purplish, meaning very high pitta. In TCM, it means blood deficiency, internal cold, blood stagnation, extreme heat, damp phlegm, alcohol. It means, and what is the organ associated with this high pitta is your liver or Ranjak pitta. Biomed, it means venous stagnation, slower blood circulation. So we're going to give, so this really means that pitta has traveled to Rakta Dhatu. So there's a dusha here in Rakta Dhatu. So pitta in Rakta Dhatu, you have to give, what is the herbs? You'll give bitter herbs, you'll give dandelion and neem and karela and a lot of bitter herbs here. Blue is Agni and Pitta out of balance, Kapha is high. Also blue is, if it's too blue, then there's a Vata derangement of the heart. Heart is not pumping enough blood. I'll give you one example of one lady who came last year, and she had just moved to the United States, and she was very nervous, and first time in another country, and she wanted to have a baby, and her tongue was very blue. I told her not to, I said, your heart is not pumping enough blood, you're scared, we need to strengthen you up, you need to do meditation, and then you should try for a baby. But she tried anyway, and she aborted within 3 weeks because the baby's heart was not, developed. That was an amazing, and now of course she comes to me regularly. So blue is Agni and Pitta out of balance, and Vata is very, very, very high. Sometimes it can also indicate Kapha and Vata mix issues. Please remember, if you go to another Ayurveda school, they might say this differently because in Ayurveda at the end of the day is a philosophy. So you might get different versions in different places. If it's contracted stiff, it's Pitta and Agni disturbance. If it's deviated, it can be high Vata and a nervous disorder, especially behavioral disorder. It could be, like I said, it could be schizophrenia, some kind of ADD. Also, if it's completely deviated in one side, there are chances. If you look at Dr. Ladd's book, paralysis, but that is complete. The tongue is just not able to sit still. It's completely going in one direction. It's completely the deviation, depending on the size of deviation. If it's going too much on the left side, we can do some asanas on the left side as well. So yoga therapy is actually pretty good at this point. Also, if somebody has seizures or epilepsy, you will see that their tongue is deviated as well. If it's a limp tongue, again, Vata is high, Prana is low. If it is smooth and it's very white, then the Kapha is out of balance. If it is swollen, Kapha Pitta disturbance. Now this is a lot to take in. So what I'm doing today is just introducing you because you've got all these forms to fill, just to get started on the forms. But when we'll actually do Ayurvedic diagnostics and Jihva Pariksha when everybody's here, either in December or at the next workshops going to be in April. If it's very protruding, but this, we are not telling you what portion of the tongue is protruding. Wherever the tongue is protruding, that could be a Pitta imbalance. If the trembling tongue, I told you the Vata is always trembling. You might also see red dots on the tongue. So we consider that hyperactive. There's too much activity going in that portion. So if you have a lot of red dots in the red tongue, it means Pitta has gone to Rasa Dhantu, and it's the Vata is fanning that flame as well. Now we are coming to the Ama. Very, very white coding is high Kapha. You immediately want to put a person on a Panchakarma cleanse and a soupy anti-Kapha pacifying diet. Again, yellow-orange is high Pitta. So I'm going to leave it right here because really what I want at this point is for you to look at the tongue, basically, look at the coding, look at the Kapha, Pitta, and Vata portion of the brain, of the tongue, and examine that, okay, right now, Vata is out of balance. Remember, tongue may change from day to day. That is your Vikruti. But what has been there for a long time, that means the doshas sometimes can take years to travel from, one dhatu to another. So when somebody has Shukra dhatu issue, obviously you're going to work on the Rasti dhatu. This is Shukra dhatu, you're going to work on strengthening the Asti dhatu, you're going to work on the Mamsa dhatu. If there is Mamsa dhatu Kashaya, we have to work in think of it as an onion. I know it's a very, very bad example. So the Vikruti of a person is like, if you have an onion and it has so many layers. So every time we have to take one layer of Vikruti out. It's a step-by-step process. Panchakarma in India is anything from 3 weeks to 3 months to 6 months. In this country, it's 5 days. I am sorry, we can do nothing in 5 days. Nothing. You have to follow a lifestyle for a year, 2 years before we, make an impact for the rest of your life. So, any questions? I'll actually have Midori do this. These are some of the books that we've used. Ayurvedic Tongue Diagnostics by Walter, and of course, Textbook of Ayurveda Volume 1 and 2, Traditional Chinese Medicine Diagnostics by Xiao Yi, Chinese Herbal Secrets, ChinaLifeWeb.com, if you want to look. Also, Aaron Ananta has tongue posters. I think some of you have it. And indentions are indicative of vata and malabsorptions. Absolutely. Malabsorption, assimilation of nutrients, and definitely vata. But the thing is, we are going to look at which portion of the tongue these indentations are in. If these indentations are smack in the back of the tongue on the left or the right side, and the person is craving salt, then it's kidneys. If it's on the top of the tongue on the left and the right side, that's your lungs. If it's right on the top and the tip of your tongue, then it's thyroid. If it's right in the center where stomach is, then it's indicated that there's Vishama Agni. So indentations, cracks, coloring, coating, which portion of the tongue are they in? That's what we are also looking at. Any other questions? So I was going to introduce Ayurvedic herbs today. So I'm just going to, and actually I've been introducing them for a long, long time. But what I'm going to write here is a couple of rasayanas. So rasayanas are one of the most amazing herb mixtures that come out of Ayurveda. And I was going to start with how, now Ayurvedic spices are also herbs, there's no difference. And we've already done Rasa, Virya, Vipaka, Guna, Prabhava of each spice. That is herbology. But the methodology of preparation and the dosage, then it acts as a medicine. If you're taking half a teaspoon of turmeric and putting it in your khichdi or soup, yeah, that's nice. But when you want to take the turmeric for purposes, let's say cataract or allergies or in flu season to prevent some kind of issue, then you're going to take 1,000 milligram. You need that curcumin extract. Now, turmeric is not absorbed by the body very easily. So you may take 4 teaspoons of it, only 1/4 teaspoon is absorbed by the body. So how are we going to prepare this turmeric that is absorbed by the body? That preparation is what we're going to focus on in the herb. One way is you heat the ghee, and when the ghee is hot, you pour turmeric in it, and the ghee will extract the curcumin from the turmeric, and that is what's going to be absorbed. Now it will be easily absorbed. So even taking pure curcumin extract, 1,000 milligrams, so the dosage is very important. For example, omega-3. If you are taking flaxseed, 1 teaspoon, it's not enough omega-3. It's the extracted omega-3 that's important. So we extract the rasa. For example, if you take a little bit of ginger, it's very good for you. But if you want to use ginger for, let's say, cold, flu, or some kind of allergy, or you're recovering, then you want to make a ginger juice. You actually run a half a kilo, 1 pound or 2 pounds of ginger through a juicer. That comes out, and you mix it with turmeric, and you mix it. So it's called rasa. You make a rasa. You're actually taking ginger juice as a juice, and you're drinking that. And that's a high dosage. So when the same spices we have done, turmeric and ginger and cumin, when we are increasing the dosage, we are changing, we are extracting. So sometimes, for example, ashoka can be, if somebody has digestion issues, they're not digesting anything, assimilation issues. So in herbs, how we are preparing, what is the dosage, what time they are eating, it's called daishajya. In Ayurveda, that is also very important. So I'm going to go back to the Ayurvedic nutrition module and ask you to look at the herbs. And I'm going to ask you to prepare your own Ayurvedic churnam. Churnam is powder. Mixing Ghritam, mixing Brahmi and Triphala and turmeric in ghee. So you can extract the bioconstituents of these spices, either in alcohol. So do not try this. I think last year there was a student, she tried extracting some senna in vodka. Not really. You want to do it in a wine. It's called draksha. So, we'll talk about that. I'm going to put these recipes up in Ayurvedic Nutrition. And then starting, you don't have a class next week. November 1st is Jyotish. So it's your first, not the core curriculum, but it's your peripheral home study module. Normally, we won't give classes, but there's so much interest from all the students to have classes. So Rose is the teacher, and she's going to give 4 classes in November on Ayurvedic Jyotish. And then everybody, you have to know your Sanskrit as well. There's 20 hours of Sanskrit. It's home study. And then there's a test. Then yoga therapy access is also being given. Again, it's home study, but Midori is going to do some classes. And then December is just diagnostics. It's just 3 or 4 days of diagnostics. January is herbology. And then also you're starting doing your case studies from this month, from the ANUT 101 evaluation module. Any questions?